The following program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.
It is 11:06, and set to go. PinPoint Health Show right here. Dr. Lou is ready to rock. The phone lines are open as well. If you have any questions about your own personal health or calling on behalf of a friend or a family member, colleague, no problem. Bring it on. 416-870-6400. Again, 416-870-6400. info@pinpointhealth.ca and the Lou Down. That's L-O-U. The Lou Down is the long-form podcast series that Dr. Lou's been doing for a while now. Some great stuff on there as well, but we are live here till just before 12 o'clock. It's early. It's 7 minutes after the hour, so bring it on. A beautiful, sunny, chilly Saturday afternoon of January. Hey, pal, how are you this morning?
Hey, John, I'm good. How are you?
I'm ready to roll. What do you got for us today?
Well, I mean, being the new year, I know we had a show last week, but we didn't take calls. We were discussing specific topics. But this week being a show where we can take calls, my favorite part of doing this, I'd like the calls to come in, and I don't think there really should be any shortage of them when we consider what's going on in the entire healthcare system. Not necessarily, I don't want to keep talking about the whole COVID stuff, but the reality is that the consequences of that virus on the other aspects of people's health is tremendous. And I feel like it's not getting the attention that it deserves. And I know that at the clinical level across the PinPoint Health clinics, we're definitely seeing the repercussions of people's health in terms of, things being sidelined as a result of the virus. And this isn't me playing a blaming game. Like, I'm not trying to say that it should be one way or another. I'm just saying that it is the reality, and that there are a lot of people out there that have sort of put their health on pause. I unfortunately learned of a very sad story in the past few weeks, which sort of had to do with somebody succumbing to something that was very much preventable. But because of the fear of going to a hospital with COVID, this person was elderly, decided for a number of days to not go, and as a result of that, got worse and worse and eventually passed away. And this was on a personal level, a friend. And so hearing that type of story just brought back to me everything that I've been discussing over the last number of months since this whole thing started, where the messaging around this, I think, needs to be better. People cannot be putting the other aspects of their health on pause. Another good example is this past week, my mom was not feeling well, was quite sick. I went and I checked her out. She was otherwise fine from a vitals perspective, but I basically said, if anything gets worse, I'm going to send you to the hospital. And immediately she said no. And I said, well, why not? And she's like, I don't want to get COVID-19 and die from that. And to me, it was like, people need to stop and remember that there's other things that can kill you much sooner than COVID-19. And I'm not trying to be cavalier about this and saying don't worry about COVID-19. Of course you should worry about COVID-19, take all the necessary precautions, but I don't think that it is the only danger that we face as humans and in a health crisis. And so there are other things that are always ready to get us, whether it's a heart attack, a stroke, some other serious illness that you're succumbing to. I'm not telling you that if you wake up and your toe's a little sore, jump to an emergency room. But if you think that there's something there that could potentially be worse, you're unsure, utilize the healthcare system, utilize the things that you would otherwise utilize, because the consequences are much worse. And I think people are forgetting that there are other things that affect our health and kill us. But I'm doing that for a reason, because I've now heard too many of these things over the last number of months, of people with things that are very, very preventable if they get the early attention that they need. And because of a fear of a virus, because everything that's being told to us, which I think, again, I'm not saying that this virus isn't scary. I'm just saying that there needs to also be clear messaging when it comes to healthcare, that if you need to get the healthcare that you need, you should go do that. You should not put that on hold. There are other things that you should be putting on hold, right? Like, socially distancing, staying away from social gatherings with friends, family, all of those things that public health has recommended are the right things to do. But the one thing that public health has never recommended is to put your health care on the line, and stop seeing, the regular doctors that you would see, or if you've got something going on. I know that, again, at PinPoint Health, almost 10 clinics, dozens of practitioners at every single clinic, operating 6 to 7 days a week, depending on the location, 12 hours a day since March. We thankfully have had nothing go wrong in terms of an outbreak or anybody catching the illness. So, and I'm just using that as an example to highlight the level of safety and precaution that we're taking. And so I think people, when it comes to their healthcare appointments, should be going and still seeing their healthcare professionals, and getting the care that they need, especially if it's something that is new, acute, you're unsure what it is, you've never had it before, you don't know how to otherwise manage it, and could be potentially life-threatening, right? This is not something that we really should be putting on the sideline.
And to the most extreme degree, to back up what you're saying, I just found out yesterday, my older brother had a friend for many years he hadn't seen in a while, but apparently he just found out yesterday that this particular friend of his had a sore throat, a nagging throat for weeks and months, and partly because of COVID and otherwise, he didn't go get it checked out. Then finally, it just got a little bit unbearable, and he went in to get checked out, got sent to see somebody else, and somebody else ended up being throat cancer, had already traveled to his brain. 2 weeks he was gone.
Yeah.
He didn't take care of it early enough. I mean, man, oh man, if that doesn't highlight it, and people are putting off their physicals. Something as basic as a physical, they won't do it for the exact same reason your own mom said, I don't want to get COVID-19. Well, heart attack and stroke and cancer have not decided to just lay low until COVID's over. You know what I mean? You got to be smart.
And interesting that you bring up the physicals, because that was the next thing that I asked my mom. I said, I know her family doctor very well. He's actually a cousin of ours. And I said, when was the last time you saw him? And she was like, well, maybe. I said, did you have a physical in 2020? And she said, no. And I said, well, why not? And she said, well, because of this. And I was like, well, I'm going to give him a call right now. And you're going to get, she needs to have regular bone density testing for other health issues and things like that. And she was sort of like, no, I don't want to do that. And I was like, no, you don't, she's my mom, so I can sort of, be that level of ignorant and pushing her. But I sort of said, no, you don't have a choice. I'm going to make sure you get this stuff done, because although, again, this goes back to, yes, of course we should be worried about the virus, and everybody should. This is a very real thing. It's very, very serious. I've heard of cases of people that I personally know that were otherwise healthy and have actually died as a result of this virus. And I also know people who are very old and not very well, and managed to survive. So the way I look at this is it's a bit of Russian roulette, and you don't really want to take the chance to find out if you're somebody that is as susceptible to it or not, right? Like, if we don't know what makes one person versus another more susceptible, then I think the safest thing is everyone should try not to get it. This idea of, if I get it, I'll be fine because I'm young, I'm healthy. I would throw that out the window, because I've heard of cases, again, personally, of people that are relatively young, healthy, and died. And then at the same time, I've heard of people who are very old, very sick, and have survived. And again, I don't think the Russian roulette is worth it. But at the same time, we shouldn't discount the fact that we as human beings suffer other health consequences and other health problems that are just as potentially serious, even more life-threatening imminently. So we can't put those things on hold. And I think part of this, and unfortunately I'm going to say this, is the blame has to go to the messaging around this from mainly the government, right? The government is not making this clear to people, where they're telling them, hey, don't put your health care on hold. This is a very, very dangerous thing. We're being scared by the government constantly, which we should be, but there needs to be some type of real conversation as well, where you give people the reality where, do your best to isolate, to do all those things, but don't let something else get you that's easily preventable. Otherwise, really, what are we doing? We're saving one COVID patient so someone could die from a heart attack. Like, to me, that doesn't make sense. We should be trying to do our best from a healthcare system to save all of those things. And a lot of those things, don't necessarily require going to an emergency room, right? This is the thought that everything should go to an emergency room. A lot of the times, simple daily medications, antibiotics, like the person that I was referring to ended up having sepsis. Like that is something that antibiotics early on is the solution, and you can get that at a walk-in clinic prescribed there. This isn't something that has to go to the highest level.
We'll take a short break, give you some time to grab a phone. You have concerns about this topic or anything with your personal health, don't hesitate to call through, man. That's why we are here. It's early. It's only 11:16 on a Saturday morning. So 416-870-6400. Email is info@pinpointhealth.ca and simply pinpointhealth.ca to get more information anytime online. Pinpoint Health Show. We're just getting warmed up and moving on after a short break right here on Global News Radio. And welcome back to the Pinpoint Health Show at 11:19, 416-870-6400. You have concerns about your health or someone close to you, friend, family member, old, young, doesn't matter. Bring it on here to talk and discuss. 416-870-6400 is the way we do that. So we'll get a phone call right away. Paul, thanks for standing by for a couple minutes there, pal. How are you this morning?
Good. How about you?
Good, sir. What's on your mind?
I actually worked with somebody who was confirmed with COVID. He was never in the workplace, and he's been beyond the 14-day period, and the health authorities say go back to work if you feel okay. They refuse to give him a follow-up test to confirm that he's negative, and I have heard that this is the case across the board, that people go back to work. People go to long-term care facilities, and they spread infection because the government is refusing to give somebody a follow-up test that produces a negative result.
Luigi?
Are you there? Hello?
Hello. Did we lose him? Oh,
are you there?
Paul's still here.
I'm here.
Oh, there you are, pal. Did you hear?
Yep.
Okay, go ahead.
Yeah, I heard the question. I started to answer. Sorry about that.
Sorry, we didn't hear you.
Yeah. That's okay. Yeah, I mean, I don't know what the right answer to that is. I am not an infectious disease expert. I'm not a public health authority. I'm assuming that there's reasoning for that. What it may be, whether it's right or wrong, I can't really comment to. The only thing that I will say, and I try to defer to people who are much smarter in this sense than me, and there's a couple of groups at the University of Minnesota that I've really been following closely when it comes to the evidence around everything COVID. I feel like a lot of the things that have been implemented are not necessarily evidence-driven. Take from that whatever you want. I can't speak to the exact things specifically about what you're asking about retesting and all those things. But just in general on other things, I think a lot of this is because it's so new. We don't know really a lot about it. We're learning more, and we try to do things, and I think people think that it's the right choice, and maybe it's not, and maybe one day we'll know better. But I can't really answer as to why that is the way it is.
Well, they explained to him that he could have a false positive test, that a lot of people may have that, or not. I guess it's a small percentage, because if you look at what's happening in the sports industry, all the sports people have to get 2 negative tests in a row before they can go back to their work. But yet all the employees in this province are forced not to get to. They wouldn't even allow him to get a retest to produce a negative result. They said, you're just going to clock up our system, forget it, go back to work.
Well, that's one of the things that's very unfortunate in this whole thing. Like where you brought up another point there that's been driving me crazy, where I think of that there are certain industries, and you bring up sports, where they're testing at will whenever they want, doesn't matter, they get multiple tests, and it's sort of crazy that's the way that happens, that some people have so much access, and then the general population seems to have nothing. I remember at the start of this, when there was a worry about testing a certain person who has a very, very popular podcast. I won't say who, but most people might know who I'm talking about. Kept talking about how he was testing himself every day just to make sure, and multiple times a day. And when he was having people on his podcast, he was testing them, and it was like, we've got more important things in society than making sure 2 people are in the same room to talk. Like, I'm doing it for from home, John's at home. So there's other ways to do this, and why some people have so much access to these types of things and others is, again, beyond me. I can't comment, but it is very frustrating, and I hear what you're saying.
Well, I'm concerned that this is part of the causes of the outbreaks. I happen to know somebody that works with a long-term care facility, and he said in the early days they followed that logic, and they kept having outbreaks again, and then they finally said, we're not going to allow somebody to come back if they have a negative test, so they have to go find some place that will test them, because the public health places won't. When you go online to fill out the forms, if you've tested positive, they say, no, we're not going to retest you. And so he at the long-term care facility made a change and wouldn't allow people to come back until they had a negative, and the problem went away. So there is a certain percentage of people, and you're leaving it up to the discretion of the person. You're saying as soon as you feel better beyond the 14 days, you go back to work. And that's right there, because that person's going to be influenced by their need to get back to work. So it just seems like a flawed system. And I got to imagine that, let's say it's 5%, 10%, I don't know, 20% of the people are still contagious. Well, they're just going to go back to work and spread it amongst, 5, 10 people.
Yeah. Hey, listen, I get what you're saying. Like I said from the beginning, I can't comment specifically because I'm not in that industry. I don't do those things specifically, but I hear the frustration. And again, that was my point. A lot of these things are not evidence-driven. We keep getting told, how bad we all are, but, I stop and think and of myself, my friends, my family. None of us are doing anything. So I don't know where all of these bad people are, that that the restrictions keep getting worse and worse. Like, it might very well be, like you're saying, there's other things at play that we don't understand. And, probably also to the government, to some extent, no fault of their own, because it's so hard to control this type of thing. And so, it is what it is, I guess, at this point. But I appreciate you bringing this up. And, if anyone in a position of power in politics is listening, hopefully they've heard this.
Yeah, 416-870-6400. That is the number to use to call through just like that and ask your questions. Jeff, thanks for standing by. Good morning.
Good morning, gentlemen. How are we doing today?
Good, my brother.
Good.
What's going on with you?
I would just like to thank your radio show. First of all,
thank you.
I work in London in mental health and addictions, and at times I have clients that are, a little apprehensive in going to see medical professionals, which is completely understandable, as well as the stress of COVID and stuff like that. A lot of them don't like to do over-the-phone consultations. A lot of them don't have computers to do a virtual consultation.
Right.
So I've suggested to a few of my clients, just take a listen to the radio show that you guys have every Saturday, and a few of them have, and they're starting to become a little bit more comfortable with the aspect of possible, telephone consult to a virtual online consult. So, thank you to you guys. And, I wish our politicians would listen, but you know what? They never do. From your last
Yeah, well, it's hard, right? Because they're also an individual within a system, and you've got to stop and think for some of these politicians too. It's tough because whether they do something or they don't do something, they're damned either way, right? Because if you do something, people are going to tell you shouldn't have done it, and then if you don't do it, people will tell you should have done it. So I sort of get it, which is why the reason why it's a hard job. But to the more important point that I think you bring up with your patients and clients in terms of making sure that these people open up to being able to consider the hybrid systems, like whether, and that's sort of what I've said too, right? Like if you're that worried to get in somewhere, there's a ton of resources out there now where you can at the very least call someone. They can try to do their best to triage you over the phone. And if they really think they need to see you, but those things are really important. And to just sit there and just sit in your own home by yourself and say, it's okay, everything's going to be fine. Everything's going to be fine. Again, I've given some examples that are very, very dangerous. People are dying from this. This is real. This is a very, very real thing that it's killing people by being overly cautious, right? I think caution is important, but you've got to consider what is a realistic level of caution where it doesn't put the rest of your health into jeopardy.
True, very true. But like I said, my clients I deal with in the London area are doing much better. And like I said, this radio show has been a contributing factor since the COVID has started. So thank you once again, gentlemen.
Thank you. That's a very nice compliment.
Thanks, Jeff. Appreciate it. And, continued health, my friend. Enjoy the rest of your weekend. 416-870-6400. That is the number. Use it. You still got lots of time. Hi, Lisa. Thank you for standing by. Good morning.
Good morning. How are you?
Great, my dear. What's on your mind?
So I'm not COVID related. I've been struggling a little bit with what seems to be an autoimmune disorder, which it seems to be kind of challenging to diagnose. And I was just wondering if you had some advice for that.
Sure.
So I've always been, a highly active person, very low pain tolerance, very high pain tolerance. And I find when the gym started to shut down, I used to do those high level gym classes. I felt, I started to kind of slow down. And then all of a sudden I'm noticing, like a little bit of psoriasis popping up, and then many different pain issues where, right now it's currently in my left hand, where I've completely lost the use of my left hand. It was in my left foot at one point. The main part of it at the beginning of the year was in my back. And so I was starting to think ankylosing spondylitis, because there is somebody in the family that has that, and they did test positive for the gene. But I'm kind of getting passed around to different doctors, I think they think I'm just kind of whining versus having.
Yeah. So can I just ask you to clarify something? You said that you've lost complete use of your limbs at points. Am I understanding that right?
So, in like a part of my hand right now. So like in just a very small part of my hand.
Yeah.
I like to do push-ups, but I can't do a push-up because I can't put any pressure on that side of my hand now. I can't open a jar, anything to do with pressure, or like the two fingers. Like my
now, is it because of pain or because of actual loss of strength, like where you can't move that side? Like, do you get, I'm trying to distinguish between soreness and an actual weakness.
I see. I think it's more of a pain. Like
okay.
To do that. So sorry. Yeah. And there is a lot of,
okay.
And you do see a little bit of bumps kind of in it almost when the inflammation.
Okay. And I'm assuming you've had at the very least initial blood screening for inflammation, and was there anything significant there?
I did test a little bit higher for the, I'm trying to remember the name of it now, but it's the one that tells you your level of inflammation. I did test.
So probably either ESR or C-reactive protein.
C-reactive protein.
Okay, yeah. So there's some inflammation going on. Yeah. So I mean, like, the difficult thing about inflammatory conditions as a result of autoimmune diseases and inflammatory spine and musculoskeletal conditions is they unfortunately do take a period of time to diagnose if it is there, right? And a lot of that is, like, I know you bring up ankylosing spondylitis and you bring up the gene, but the presence of the gene doesn't confirm the diagnosis of ankylosing spondylitis on its own. A lot of people have the gene but don't have ankylosing spondylitis. It's very much based on a lot of different things. So that's why people don't get sent for that right away, because it's not going to actually provide anything if they don't see other manifestations. So and I know, and I think a lot of the problem here is the communication back to the person suffering with these things, because, they think it's either like, well, can't this just show up on a blood work, yes or no? And that's what I'm trying to tell you. It can be harder than that. Because it takes time to really look at, like, does that CRP can be raised due to a lot of things. Does it normalize at a later point? Is this potentially diet related? Like, there's other things that can contribute to this. What I could suggest is coming in to see me, and we can go through this a little bit further. A lot of the times, just by making certain modifications in diet and stuff won't necessarily cure you, but can very much help the overall symptomology that you're experiencing. And then, like I said, it is a frustrating thing for people who are on sort of that, there might be something autoimmune. It's not something quick, right? It's not this quick, like, oh, here it is, and yes, you have this. Sometimes it can take quite a bit of time to actually figure out if that is the thing. And you don't want to jump to that diagnosis if you're not absolutely sure either.
Yeah. And like the tough part is how much it keeps kind of transforming. So what initially started me, going to the doctor was serious.
Lisa, we're going to let you go from there. You want to reach out to any further, you can do so. PinPointHealth.ca, info@PinPointHealth.ca, 1-855-55-Dr. Lou, DRLOU. That is how you have a further conversation. But right here and now, we got plenty of time, plenty of open lines. It is 416-870-6400. That's the way. PinPoint Health Show, Global News Radio. And right back at it, 11:37, PinPoint Health Show with Dr. Lou, 416-870-6400. 11:37, yeah, nice and early still. Beautiful sunny day out there. Get outside and walk around and get some fresh air into your lungs for sure. With distance, as they always say. Want to mention as well, Dr. Lou, your clinics are open. I was there the other day picking up a cool pillow for my neck, which has been pretty awesome, by the way, so far. So you guys are open for business with full sanitization and all the protocols. It's a beautiful thing, and busy, too. So some people are getting the message that they should still be taking care of their health because our good pal Angie there said, running around like crazy. So that's good. That's good to know.
You know, John, if I could say something about my PinPoint Health team, just the incredible job that they've been doing throughout all of this, and one of the things that I find, the patients have been telling us that they, the last caller that we had that sort of brought up that people still want that person-to-person interaction for help. They don't necessarily trust just a phone call or a video thing, and especially when you're dealing with bodily problems, we are providing that service. And I think a lot of people appreciate it. And again, just from a purely, never mind the statistics, what I can tell you is the statistic that I know. We've been doing this since COVID, and, thousands of people a week at dozens of clinics, and nothing. There's been no outbreaks, nothing like that, thank God. And that's the result of everybody doing their part, whether it's the staff, the patients, knowing when they should and they should not come in. Our people are smart enough to know, hey, I don't feel that well. We get the calls. Hey, I woke up, I have a sore throat. It's best I don't come in. Yes, thank you for taking that level of precaution. That's what we need. That we need every individual to sort of just be a little bit smart with this, and we won't need severe rules and things from others telling us what to do. If we all do our part, we can all really actually get through this.
416-870-6400 is the way to call through. You got lots of time. Bring on your calls. Get some answers before you go forward any other way. What else you want to cover off this morning, pal? We still got lots of time.
Yeah, so one of the things this time of the year, classically, you and I were speaking about this week, John, is the time where everybody wants to get back into health, and it's a new year, so everybody's trying to make a New Year's resolution. The harder thing this year is the gyms are closed, right? So people don't have that place. However, I think it's an important thing that people get to, at the very least, a point in time where they say, okay, you know what, I need to do something about my health. My encouragement here is don't let the excuse that gyms are open stop you from doing something. There's a lot of stuff that you can do within, a 4x4 space of your own house. And sometimes it's simple things. You can squat, you can push up, you can crunch, you can do different exercises, right? And there's tons and tons and tons of resources of this online on YouTube, different apps where, especially throughout COVID, where people are trying to stay healthy in a way where gyms may not be available, and the regular recreational activities that you do. I just think it's so very important that people still try to force themselves to do something. I saw an amazing quote this week that said, exercise is optional, but movement is necessary. And I looked at that and I said, wow, that is so true. Like, a formal exercise program is very much something for humans that is optional. But the idea that you should be moving around, doing things, breaking a sweat in your natural environment is not optional. That is necessary. That's what we're designed for. And if you're spending this time just sitting on your couch, eating unhealthy foods, watching TV, all you're doing is making your health worse, and you're letting a health crisis dictate you becoming unhealthier, and it's sort of counterintuitive. And really what you should be doing is trying to be as healthy as possible. And my messaging goes further in that when people are doing these things, what ends up stopping people during this time of the year, and you and I spoke about this again, John, was that, typically at the clinical level, at around week 3 of the new year, we see a whole bunch of people coming in who are hurt from doing something, right? They've decided to get back into activity, and maybe they have a treadmill in their basement or a stationary cycle, and they want to start doing it. And, they used to run 5 kilometers 2 years ago, and they think that all of a sudden they haven't done it in 2 years. They'll get back on there and run, 5 kilometers at a speed of 6 or 7 or something like that, and then they end up hurting themselves. Don't do that, right? The biggest and most important thing when you're reintroducing activity, and it's something that we use even with people with return to work guidelines, you've got to stagger it. You've got to introduce these things slowly, get your body used to something, then up it a little bit and try to modify it as much as possible. So, if you used to run 5 kilometers, a decent jog a couple times a week, I wouldn't say that you should start with that. What you should probably start with is get on that treadmill and do a walk, do a 15 or 20 minute walk for the first week, at a nice, decent pace. The next week, pick it up a little bit, maybe throw in a couple spots where you'll jog for a little and then take it easy. And then, maybe by week 3, 4, 5, 6, you start sort of getting back to where you were once upon a time. But the idea that in week 1 or 2, you're going to be back where you were 2, 3 years ago is a very, very dangerous thing when it comes to injury. And that injury, it could be a reason that a lot of people get sidelined because, using the example of trying to get back on the treadmill, running a little bit, it's where you found that it helps you to lose weight, whatever it may be. You do something silly like this, and all of a sudden you tear your meniscus. Well, you're going to be out for a long time, and then you're going to look back, and before you know it, it's going to be the spring, and you're going to say, geez, at New Year's, I wanted to lose 20 pounds, and since New Year's, I've gained another 20. And that's probably the result of just trying to do things too quickly. This is very, very much a marathon and not a sprint when you're trying to get healthy. So don't think of January as the month where you're supposed to get healthy again. It should be you're thinking of the entire year and plan something out that takes into consideration the whole entire year.
Just take baby steps, man. Just little baby steps. One little victory in a day. Getting your health back is, you got the time. Most people have the time now, right? So, get in there and do it. We'll take a short one. You got some time here to call through. Talk to Dr. Lou. 416-870-6400 is the way. You can go to info@pinpointhealth.ca. And the Lou Down, the long-form podcast, can be found anywhere you get your favorite podcasts as well. We'll return with more of the Pinpoint Health Show. This is Global News Radio. All righty, welcome back. 11:48, Pinpoint Health Show, info@pinpointhealth.ca, the Lou Down, the long-form podcast, and anytime you want to reach Dr. Lou when we're not doing the show, 1-855-55-Dr. Lou, DRLOU. But here and now, still got some minutes, so feel free to call in with your concerns, 416-870-6400. Yeah, there's nothing like learning something a little new when it comes to your health, even though you're bound by 4 walls of your house. You can always do something, right? I mean, it's,
But yeah, like you were saying, John, you managed to buy a set of dumbbells, when they were still affordable. And again, you don't need an extravagant amount of equipment to do something that keeps you healthy, right? Like, I get it that if, you're a bodybuilder, well, then, you probably need a gym to get you to where you need to be. What I'm talking about is how do you keep healthy? And health is a very different thing than, having very big muscles. And so my point is there's a lot of things that you can do without any specialized equipment at all. And even if there is some equipment, it's very minimal, that you can do in the comfort of your own home. And this is not something you need, a 3,000 square foot home. This is something you could be doing in a 500 square foot condo. So really, everyone sort of has this ability, or most people anyways, have this ability to be doing something. The other thing, that's the simplest thing you can probably do, is get out there and go for a walk. I know it's cold, but just dress warmly. You know what I mean? Like, put on a hood and a jacket and a scarf and gloves and just get out there and go for a nice walk. Like on a day like today, John, it's cold, but it's beautiful. The sun's out, some fresh air, and if you wear the right amount of clothing and the appropriate things, it's going to be really beneficial for you to go have that walk, and so those are some simple things. I know it's not ideal. I know that. And I know a lot of people are saying, no, but I want to get to the gym. So do we. So does John. Like, of course, we all want to do that. But I'm talking about you've got to sometimes sit there and think about what the reality of your situation is. And the reality of all of our situations right now is that this is the only option that we have. And if it's the only option that we have, try to make the best of it that you can. You don't, again, want to go back to letting a virus sacrifice the rest of our health. And this is sort of the way we started the show, talking about very serious things that can kill you, and we're ending it off with the things that if you don't do over a long term are not beneficial for your health, right? So don't let a health crisis like COVID-19 be the result of your other health crises, right? Like try to stop and think that there are things that you can still be doing. Whether, again, like we said at the start of the show, if you're feeling something that you've never felt before, it's acute, you've heard of symptoms like this, might mean it's a stroke or a heart attack and you're unsure, call 911. Go, especially right now, I know a lot of paramedics that have started to become vaccinated. They're rolling it out to the front lines for that reason. So if you've been worried, try to put that worry at ease. Utilize the healthcare system, but also utilize the system that keeps you healthy, like being active. And a lot of that is in your control, right? The stuff that you can do. If you're one of those people, even going towards diet and healthy eating, if you know that buying bad things is going to predispose you to eating those bad things, well, when you go to the grocery store, just don't buy those bad things right now. The worst thing you can be doing for yourself right now is making yourself unhealthier. So if there's things that you know that you can't control because it's just who you are, don't even buy it. And I tell people this all the time. I have friends of mine who'll tell me this stuff, and I always say, well, why do you even buy it? Well, I don't know. I'm there, so I buy it. It's like, well, why don't just don't buy it. If it's not there, you're not going to be able to have it, whatever it is. So, and people think that there should be an easier way. There's no easy way. Be hard on yourself sometimes, right? Have some level of willpower. Try to do something and try to stick with something, and stick with something for 21 days, because we know based on research, that's what creates a habit. And if you do that, you'll be very thankful. So I'd say in January, make this about willpower. Eat healthy. Try to do something at least 3 or 4 times a week that includes some type of physical activity for half an hour. Keep doing that, and you'll see the improvements will happen in terms of your health. Again, this may not be ideal if you're a bodybuilder, but you want to keep healthy, and that's the key that I'm trying to get across.
Yeah, you might learn and try something new that you never thought. Even as a dedicated gym rat doing something at home, you might think, you know what, I actually kind of enjoy this. I'm going to stick to this when we come out the other end of this thing, and however long and how many months that takes. That you might actually become a habit, and you'll stick with it, and it might end up actually saving you a bit of money if you do it the correct way too, right?
It's a great point, John. There's a lot of people that are gym rats, but they lack flexibility, movement patterns. Why not try yoga? Right? There's tons of things out there where you can watch a simple beginner's yoga class and try doing. Like, there are different things that can challenge all of us. And if we challenge ourselves, the same thing is like, there's people that lose weight by doing interval training, and they use a treadmill or a bike for that. You can do interval training with other things, with jump movements into squats, into a push-up, and then, and do that a number of times, get your heart rate to a certain level, and then stop and break. Like, there's other ways to create these types of overall workout plans, and trying something different. And we all want to get back to the point where we're doing our normal things. And I guess, again, this isn't ideal, but it's the best that we have right now. And I just encourage people to do the best with what they have.
You bet. We're done for another morning. Reach out, please, just to have a chat with Dr. Lou. He's ready to have that chat with you. 1-855-55-Dr. Lou, DRLOU, info@pinpointhealth.ca. Simply pinpointhealth.ca is the website for more information anytime, of course. And the Lou Down the Long Form podcast is available for you there as well. We'll catch you next time on the Pinpoint Health Show. This is Global News Radio.
The preceding program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.